Today I'm talking to Ashnita Prasad. She's a clinical registrar at the Southside Health and Wellbeing Clinic. She graduated from UNSW with her master's in clinical psychology and PhD. Hi, Ashnita. Thanks for being here.
Hi, Denise. Thanks for having me.
Yes. So can you tell me, what does it mean to be a clinical registrar? What do you do?
A clinical registrar is someone who has completed their master's and then has gained entry into the clinical registrar program. So right now I'm working as a registered psychologist under the supervision of a senior clinical psychologist who's board approved. But at this stage, most people will tend to practice quite widely and start to figure out what they like and also what they don't like, and then kind of hone their skills as they go along their program.
Can you describe a little bit of what it's really like day to day to be doing this kind of work?
Yeah, it's a really interesting transition to go from placement student to actual practicing psychologist. But in terms of the day-to-day processes, there would be things like supervision meetings with my senior supervisors, as well as peer supervision, and then also working with clients. So depending on the presentation and the type of therapy that you're doing, generally I'll have an initial assessment with someone that will take around an hour and a half. And then subsequent weekly sessions or fortnightly sessions that take around 50 to 60 minutes, depending on what comes up.
Is there anything that surprises you about the work? Something that you didn't expect as you were going through your training?
I think what has really dawned on me over the last maybe 6 to 8 months after beginning this role is the sheer responsibility that I hold and the power differential. So I think by the time you get through your masters and through your placements, you get to meet a lot of wonderful people, get to work with lots of wonderful clients, but you always sort of have this psychological safety that your supervisor's got your back. If you don't know something, you can go to them. And that's still very much the case for me. I'm really lucky to be in a lovely workplace, but there's still a sense of like, oh, you got to make sure that you get this right.
Yeah, absolutely. I'm curious to know more about what it was like going through the Masters of Clinical Psychology. What was the training like? What was the experience like?
I think it's a very intense time, but in terms of my experience with the UNSW clinical program, I think it was one of the best places for me to get that foundational learning. And it's good to learn the rules before you then learn how to break them.
I'd also like to know a little bit about what it was like doing a PhD. So did you do the combined master's PhD degree?
Correct.
Yes. What was that like? That must have added even more of this intensity for you.
Yes, it was a very, very intense time. I think my research informed my clinical practice and my clinical practice informed my research. So really a nice way to experience that scientist practitioner model that we talk about. But it was definitely challenging.
Could you give any advice to students who are at the beginning of that process from your perspective now?
In terms of practical advice, definitely try and get experience wherever you can. There's also ways to do things like lifeline training, or even at the UNSW level, there's lots of societies and clubs that you can contribute to just to show your interest in the profession, and also just to gauge if you still are interested, because you may do something and realize, I actually hate this, I don't want to do this. And that's fine. That just adds to your experience of knowing a bit more what you want, what you don't want. Philosophically, I would say just back yourself. And I know that's really hard, and very easy for me to say now, but I think backing yourself and ensuring that you have some sort of network in place, some sort of guidance. I am so thankful for the people who took the time out of their day to tell me, hey, there's this role going, you should apply for this, or have you checked this out? Maybe this will be helpful. And I think at the undergrad level, it can be intimidating to ask for help or to ask for guidance, but definitely I'd really encourage you to do so. And you might even be surprised by how forthcoming and willing people are to help you on your way, because we all know how hard it is to get here sometimes. And so if there's something we can do to give back and help people get into the profession, then more people than not are willing to help out.
Thank you so much. Thank you for talking with me today, Ashnita. It's been a real pleasure.
No worries. Thank you so much for having me.